Maine voters will decide whether to overturn a law that requires Maine students, babies in daycare, employees of nursery schools, and healthcare facilities to be vaccinated unless they have a medical reason in writing from a medical professional. Now, there's an emotionally charged dialogue happening across our state, and in those conversations, online and in person, there's a lot of misinformation about vaccines. As a new mom myself, going through the vaccine schedule with my 5-month-old son, I certainly have questions, and questions that can't be answered with a Google search. I also have concerns, and I know I'm not alone. So before we decide whether vaccines should be mandated in our state, let's make sure we know the correct information about vaccines. We want to have an educated conversation with no emotion, separating feelings from facts. So tonight I'm joined by 2 medical professionals and 3 parents for a roundtable discussion about vaccines. I cannot stress enough, this is not about question 1. This is about vaccines and how to recognize the misinformation that's out there and answering the questions many parents have. So first, let's introduce our sources. First up, we are joined by Dr. Lisa Ryan. She is the Chief of Pediatrics at Northern Light Health, and she's a former president of the Maine chapter of the Academy of Pediatrics and is a former president of the Maine Medical Association. She has nearly 30 years of medical experience. Joining us by phone today is Dr. Sean Palfrey. He is a pediatrician at Boston Medical Center and a professor at Boston University School of Medicine. He has 45 years of medical experience. For the last 35 years, he has worked on immunization issues for the Massachusetts chapter of the American Academy of Pediatrics and the Massachusetts Department of Public Health. So thank you both for your time and for being here. Joining me to ask the doctors our questions about vaccines are Krista Neto, Caitlin LaCase, and Andrew Vogue. So all of you, thank you so much for being with us today. I do want to start with Krista. She's a mom of 2 boys. Her 15-year-old son, Cole, has autism. And Krista, full disclosure, she is an intern right now at New Center, Maine. So Krista, I want to just start by asking you all 3 the same questions. But Krista, what are your thoughts on vaccines?
Not whether I agree with them or not, right?
Mm-hmm.
I think, just to clarify, I think everyone supports vaccines, but I do have some questions about the ingredients that are used in vaccines and the safety of those.
And Caitlin, I'll ask you the same question. What are your general thoughts on vaccines?
Yes, thank you. You know, we're really fortunate where we have a great partnership and trust with our pediatrician. Our oldest is 7 years old, and we have 2 other kids who are 4 and 2. And we have just, you know, we've of course done our own research, but have also really feel as though our pediatrician has our kids' best interest in mind. And so I've always felt comfortable going with the vaccine schedule that she's recommended.
And you're a mom of 3 young kids?
I am, yep. Charlie is 7 and Lucy is 4 and Eleanor is 2.
Wonderful. Andrew, I want to ask you the same question. Yeah. You're a dad of 2 young children.
Yes.
When it comes to vaccinations, what are your thoughts?
We, like Caitlin, we have a really great relationship with our pediatrician. We're really fortunate in that way. Both my wife and I have had questions in the past, and the questions have been answered very much to our great benefit. So we've been very comfortable and happy taking our pediatrician's recommendations.
Okay, so when we talk about vaccines, it's important to know the different types of them and what vaccine preventable diseases there are and what they are used for. So according to the Centers for Disease Control and Prevention, vaccine preventable diseases are chickenpox, diphtheria, Haemophilus influenzae type B, also known as HIB, hepatitis A, hepatitis B, influenza, measles, mumps, pertussis, polio, pneumococcal, rotavirus, rubella, and tetanus. Before we begin, I want to make sure that our parents and our sources here avoid repeating information they know to be untrue. It's so easy to spread misinformation, and we want to be as careful as we can. Also, please avoid stating opinions. This is a place for questions and answers. Andrew, I'll start with you.
Sure.
What questions do you have for Dr. Ryan or Dr. Palfrey?
Yeah, absolutely. I guess start with, you know, as I said, my children have been vaccinated on the recommendation of our pediatrician. We've had this great relationship, but knowing that there are other children out there that are not vaccinated fully, what way will it affect my family that others aren't vaccinated?
I'm good to respond to that.
Yeah, we're both happy.
I think that's an important question. There's something that's called herd immunity, and what that is that the population that you are in. There is a level of protection based on vaccination, so that those around your children are vaccinated, and the higher the level of vaccination in the community that your child is participating in, the less likely they will be susceptible to a vaccine-preventable illness.
Okay. Can I follow up?
Yes.
Can you talk a little bit more about community immunity, herd immunity here in Maine? Where are we? How are we doing? Where are the numbers trending?
Well, the numbers are trending. The Department of Education conducts surveys on an annual basis, looking at children entering kindergarten, entering middle school, and then completing high school. And they compare that data nationally. It looks as though the number of, for some of our immunizations, we are sort of falling below the mathematical calculation of where herd immunity provides us the best protection. And the most recent data I have from 2018-2019 puts us a little bit below that marker for a comfort level with herd immunity. I think the concern is that we get below that level and we have an exposure to a vaccine-preventable illness in Maine. It raises the concern that we may have more of an outbreak of an illness.
Mm-hmm.
I have a relevant question.
Sure.
My community, Raymond, actually has only an 83% vaccination rate, which was my son's kindergarten class, was that most recent data. So what does that percentage of vaccination rate, how does that affect the herd immunity?
It obviously would, the lower the immunization rate in a given community, the more likely that a child, if exposed to a vaccine-preventable illness, the more likely that will become a problem. You know, all children, everyone who receives a vaccination doesn't mean that everyone is then immune from the illness. So not only will you have children that are not immunized against an illness, but there will be those that are vaccinated that may not have developed immunity. So it increases the cohort, the number of children that if an illness is brought into a community, that the risk that infection rate will increase significantly.
Why does that happen? If a child is immunized, what would make them not immune?
Let's let Dr. Palfrey answer this one, because I think I heard him trying to jump in.
Oh, sure.
No, I wanted to add to the last answer was that for each of the different viruses or bacteria, there's a different level of community immunity that's actually effective. So an illness like measles is very contagious, and therefore we need somewhere between 90 and 95% of the community to be immune to measles, but it is a little bit less for some of the others. So taking one number is not always safe. We do aim for about 90 to 95% herd immunity or community immunity. But knowing that there's a different level of immunity depending on which virus it is we're trying to protect the kids and the adults against. I repeat, if you would, the question that you had.
Krista, I believe he's asking you.
Oh, thank you. So if a child is getting vaccinated, why would they not be immune? We all know that kids who are vaccinated still can catch the disease they're immunized against.
Right.
So what makes that happen?
It relates to your immune system and your immune system's readiness to respond when you get the vaccine and your immune system's strength against that particular illness. So we sometimes have children who get hepatitis B vaccine, for instance, and if we check after the 3 shots, they might not be immune completely to it. So we actually will repeat the entire series of hepatitis B vaccines, which is perfectly safe and does boost up the immunity. The reason we give boosters is to do just what you're saying, is that the first one is somewhat effective, second one is more effective, third one is almost completely effective. And so getting the whole series of vaccines into a child is important.
I will jump in. I have a question about the hepatitis B vaccine given to babies. Dr. Ryan or Dr. Pelfrey, I was able to find a quick answer on the CDC's website about why it's recommended. However, if I believe the transmission to be low of my son, for example, coming into contact with another person's blood or whatnot, what is the reason for still getting vaccinated against hepatitis B?
Well, hepatitis B, the immunization, and the American Academy of Pediatrics recently came out with recommendations that vaccine should be given within the first 24 hours of life. And the reason is that hepatitis B, you're screened. Most women who get prenatal care are screened for hepatitis B during pregnancy, early on in the pregnancy. Hepatitis B is a prevalent illness, and a woman who's pregnant may contract hepatitis B during their pregnancy and not be aware of it. So if we can give that immunization in the first 24 hours of life, that provides protection for that infant if there was something called vertical transmission, where the transmission is from mother to infant. Now, I think one thing that is concerning to me, particularly in the era that we live with opioid use disorder, is that I think statistically we're going to start to see increased incidence, of hepatitis B, hepatitis C, and the problem is that when you send your child to daycare, you don't know the immune status, the hepatitis B status of the caregivers, of the other children that are attending, and we traditionally think of it as blood and body fluid. You're a healthcare worker, you're exposed to needles and you're exposed to blood in your work, but we know that the transmission can happen even with sharing a toothbrush, if you will. Mm-hmm. Moms typically will carry the binky, put it in their mouth, give it to their babies. So I think the transmission is more than just a poke with a needle or coming in contact with someone else's blood and body fluid. The transmission can be a lot more subtle. And the other thing that I'll just would throw out, because a lot of parents will ask me, well, my child isn't going to be exposed to things as a baby. We know that infants, if they are exposed and become infected with hepatitis B, it's much more difficult for their immune systems to fight that infection. And the younger that you acquire that illness, the more likely you are to suffer some of the more significant consequences later in life, like liver disease and liver cancer.
Measles is something that I was vaccinated against as a kid. My kids are vaccinated against, but I know people of my parents' generation contracted measles and survived measles. How awful is measles? What would that look like in a child now?
Fortunately or unfortunately, a lot of our doctors at the current age have never seen live measles in a child. And it does look different depending on the child's skin color, for instance, what the rash looks like. So sometimes it does happen. It's a very bad cold. It gives you inflammation in your eyes, your nose, your throat, you're coughing, you're having a fever, you feel miserable. Like so many viruses, there are variations on the theme, and so they don't always look the same. The rash does not always look the same. And the child may get not very sick or very sick from it. So those of us who have been around for a while remember seeing lots of kids with measles, so we tend to recognize it but don't think about it so much unless there are cases in our community, which has happened, as you know, over the last few years, where there have been outbreaks of measles because the cases were introduced into the country from somewhere else. But it is a very contagious disease, and the immunity that adults have if they got the natural illness is really pretty good. It used to be very good, but the immunity that we get from the vaccines often are not quite as good as if you had the natural illness. So that's why you're seeing us giving more boosters for various different illnesses, because the immunity doesn't last as well with vaccines as it does with the natural illnesses in some cases, most cases.
If I can follow up on that, you're talking, Dr. Palfrey, you're talking about outbreaks, and particularly for measles. What would an outbreak here in our community look like? How concerned should we be as parents? You said that the community immunity rate for measles had to be in the mid-90s, and there are communities like Caitlin's that are in the 80s. What does an outbreak look like there?
again, because it's contagious, it is possible that you're going to get introduction of the disease into the community that might have individuals who are not fully protected for whatever reason. It happens to be their own immune competence or their own histories. So what it would look like is that you would get sporadic cases of it in those kids or even adults who were less well protected. And so we go through the isolation procedures that were attempted in a number of the communities in New York City, for instance, or on the West Coast that had cases. But because immunity is still pretty good in this country, thank goodness, it takes, you may not see new cases even if somebody came into your community with active measles disease.
If I can just follow up with that, there was a case here in Somerset County in our state of Maine. A young girl came down with the measles. She was immunized. And I just wonder, you said earlier that when I asked about how can someone not be immune that's just gotten a vaccine, you said it would depend on their readiness to respond to the vaccine.
Yep.
What does that look like? How do we know that a child is ready to respond to a vaccine?
In most cases, if you follow the CDC and the Academy of Pediatrics' recommendations, most kids' immune systems at that age and in those circumstances is ready to respond fully. But there are some illnesses that can decrease transiently your ability to respond to the exposure to various viruses. Or, for instance, we have a schedule for giving vaccines that if you give two vaccines too close to each other, depending on what kind of vaccines they are, you don't get as good an immune response if it's too close. So there are a number of factors. Most people will respond nicely if you follow the CDC's recommended schedule.
I want to jump in here too. From the word most that Dr. Palfrey is mentioning, a lot of the conversation happening in our state right now is about medical exemptions. My question is, what conditions qualify for a medical exemption, and is that list set in stone or is it expanding?
I think not only the medical exemption, but I think if you look at vulnerable populations, for example, infants prior to the age of 2 months, where they first get some of their first immunizations against the HIB and the pneumococcal and the diphtheria, tetanus, and pertussis. And then the elderly who may have waxing immunity and may have more chronic medical problems are going to be more susceptible to illnesses. The medical exemption is for children who have a compromised immune system. There are some disorders where that's the case. Children who have received organ transplants, children who have cancer and are on chemotherapy are much more susceptible. So there are illnesses and disorders and even treatments with different medications like long-term steroid use for a chronic juvenile rheumatoid arthritis that may make you more susceptible and your immune system not as able to fight any of these infections.
I was speaking with a viewer this morning, and I think, Dr. Palfrey, this would be a good question for you to answer. We were talking about genetic testing and genetic mutations. How does that come into play when we're talking about maybe an instance where a vaccine does not cooperate nicely with a patient?
At this point, we know so little about the specific genetic conditions that prevent you or enhance you from responding to a particular vaccine that there's not, as far as I know, individual recommendations or recommendations not to or to immunize, depending on your genetic status. So that in general does not come up as a cause for a medical exemption. The medical exemptions are, as was just explained very well, are much more specific to the child's medication status, disease status, or on very rare occasions, allergic status. So there is a very small percent of any population that should be eligible for a medical exemption. It's less than 1%.
I have a question.
Sure.
It strikes me that all parents are trying to do what's best for their kids, and I'm just wondering if you can talk us through. I think a lot of parents are struggling weighing. What's the biggest risk? Is it the vaccine and potential side effects, or is it these diseases that have been known to kill? And how would you suggest, as pediatrician and experts in these areas, how would you walk a parent through thinking through those decisions? I'm just wondering.
I think it's a very important part of a conversation that we have at every well-child visit from birth, really. And if we have the opportunity to meet with families before babies are born during prenatal consultations, it always comes up, and we talk about lots of things in well-child care, and certainly immunizations is huge. I think that every visit when a child comes in and is due for immunizations, we talk about what the illness is, we talk about the potential side effects. By far the most common side effects that we see are some discomfort and some low-grade fevers or some sleepiness.
Side effects of the vaccine.
From the immunization, the vaccination, yes. And it's having a dialogue and a conversation and being available to, I always tell families, if there's anything that you're concerned with, call. I need to know about that and I need to hear about it.
Dr. Palfrey, real quick, you were about to jump in.
Well, what I wanted to say is that the relative risk of the illness is so different, and people don't understand that polio, for instance, was a very serious disease because we don't see polio in this country anymore. We rarely see measles. We actually rarely see even chickenpox. So that what's out there in the community, the parents who are relatively young may not ever have seen this, or because it's not out there anymore, feel that the illnesses themselves are not very dangerous. So in terms of the relative risk for vaccination against anything, driving your car is much more dangerous, guns are much more dangerous, food is much more dangerous, climate change is much more dangerous, nuts are much more dangerous than the vaccines themselves. However, if you were living in a community somewhere else in the world where these illnesses were around, you would have much more dramatic fear of the illnesses themselves. So an example is right now the coronavirus issue. People are very fearful about coronavirus, but so far it has not shown to be more serious, for instance, than flu. And so our response has been get your flu shot, and yes, if there is introduction of coronavirus into your community, learn to protect yourself, and that's what we're there to help people with.
Krista, you had a question.
Well, so we're talking about the minimal side effects, maybe a little sleepiness, a little fever. Given how long you've been in the medical field, both of you, surely you've seen more serious side effects, haven't you? What does that? Can you speak to that?
Sure.
And I'll speak first, and then I'm curious for Dr. Palfrey's response also. I've been practicing for almost 30 years. Obviously, have not personally given, but have been been a provider for children who have had probably thousands and thousands of immunizations. Probably, it's an easy question for me to answer because the most common, more significant adverse effect was before the introduction of acellular pertussis. So if you think of your DTaP, which is diphtheria, tetanus, acellular pertussis, we used to just do the DTP, and that was a whole cell pertussis. And I had several children who would cry for, more than 4, 5, 6 hours in discomfort. And I probably would have, in my 30 years before the acellular pertussis, a handful of infants that had that as a more significant reaction. I've had a couple of children who have had immediately after the measles, mumps, rubella, what looked like more like a hive allergic type reaction. And I've worked with my pediatric infectious disease colleagues, and those children have been able to get their subsequent boosters without any problems. And that's probably the worst of what I've seen.
Yeah, Dr. Palfrey, if you want to join in on that.
No, I completely agree with that. I think that the vast majority of the adverse effects to the vaccines themselves are pain and irritability for a brief period. Some of the vaccines, for instance, the measles, mumps, and German measles, measles, mumps, and German measles and varicella, are live virus vaccines, and they're very, 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 very weak. But the body responds to them sometimes by producing a rash 10 days or 2 weeks after getting the vaccine, which couldn't matter less to the kid, but the parents see it and they worry that this is the real disease. For the most part, what people worry about is that the child seems to get sick after getting the vaccine. And that illness is almost never related to the vaccine. It's much more related to the fact that in the winter particularly, there are lots of other viruses around that the child might have been developing at the time of getting the vaccine. So there's a fallacy called post hoc fallacy, which means having something happen after something else. So people used to think that if a black cat walked in front of you, that was bad luck. We now know that's not true, but people do feel that if they got sick after the flu vaccine or another vaccine within the next 10 days or 2 weeks, that was caused by the vaccine, but it almost certainly wasn't. So I think what we're saying is that before we had these vaccines, the children who got the true illness could be very sick, but now that we have vaccines, the incidence of any kind of response either to the vaccine itself or to the virus is so much lower that we have a very much healthier population.
In the interest of Dr. Palfrey's time and your time as well, I know he starts seeing patients in the next 7 minutes from when we've recorded this. So I do want to include a viewer question that I received overnight. Christy Renee asks, how dangerous is it to have students during that 6-week transmission period after their MMR shot in schools? Now, this is something I actually looked up as well for the chickenpox vaccine, and it does say in the warnings, avoid being around people who could be at risk in that 6-week time frame. So Dr. Ryan, do you have a response to that?
I think, once again, I think that the issue is, are you shedding some virus after a live vaccine? And I think that what I tell my patients is that, once again, I think it's best to minimize exposure to someone who has a compromised immune system. So, for example, if a grandparent is having chemotherapy and undergoing treatment for cancer, I say it's probably a reasonable idea to avoid contact immediately after the immunization. Now, I think for going to school, where once again, we're looking at the community immunity, I think if you have a competent immune system, I think the risk is much less likely.
Yeah.
And in fact, in a well-vaccinated community, if a child has just had, say, the chickenpox vaccine and may shed that weak virus, that actually boosts the immunity of all the kids around him. So the risk from a live virus vaccine is extraordinarily low unless you're undergoing bone marrow transplant or something else, and that child is probably not going to be in school.
Okay. I believe we have time for some final thoughts here, so we'll end the conversation there. But before we go, I do want to ask each of our parents for some final thoughts. So, Krista, after this conversation, have you learned anything new? Has anything changed for you?
I don't think I've learned anything new. I had, like 8 more pages of questions, but I over-prepared for sure. I think the thing that I'll take away from this is what Dr. Palfrey said about a child's readiness to not only receive the vaccine, but then be immune to the disease that they're receiving the vaccination for. I didn't know, and I just wonder, I know he said based on the schedule, most kids are able to receive those vaccines in that time frame, but I don't know that we can blanket everything. I don't think that one fell swoop covers all children. So that's kind of my takeaway. I have a lot more questions, of course.
Caitlin, I'll ask you the same thing. Anything you learned today, anything different for you, anything that you're still curious about?
I think it was really helpful to hear from the experts who are on the front lines and talking with families and who have this vast experience in giving vaccines to folks about how much it benefits both their patients, which is a really important piece of it, and also the community as a whole. And I think that was a helpful conversation to have. So thank you.
Sure, Andrew. And final thoughts from you? Anything changed for you?
No, I think I learned some things I hadn't from both of you. Thank you, Dr. Palfrey. Thank you, Dr. Ryan, for being here.
Thank you.
It's great to know that there are so many passionate and talented and smart people taking care of all of our kids and all of our community. And I appreciate you bringing both that passion and the knowledge to this conversation.